Over the years, I've had questions. I have met people who have not been able to get that dream job or close that deal or even get the kind of relationship that they want. Not because they are bad people, okay? But because they're not confident, they're not proud of their smile. I've actually had some people send me DMs, Doc, I don't smile. It has cost me jobs. It has cost me opportunities, relationships. And when you look at their pictures, you don't see anywhere where they actually smile and show their teeth. A smile is something you wear. People see it before they see you. I feel you. But you see, you can't die in silence. Don't feel like all hope is lost. All hope is not lost. In situations like this, something can be done. You can come in and have a smile makeover. You can have braces done. We can align that occlusion once again. A smile is something that will boost your confidence. I've had people say, oh, Doc, I have gaps. And when I talk, saliva is flying out of my mouth like interballistic missiles, someone once said. Or, Doc, I feel like when I'm talking, air is escaping and people can't really hear me well. I don't have the confidence to express myself. These are some of the things that could happen when you have malaligned teeth. So many things could be going wrong. If you have teeth that are crooked, that are not properly aligned, they could actually cause bad breath. Why? How? Accumulation of calculus, tooth decay, in between those teeth that are overlapping or crowded. So there are a lot of downsides or detriments, more or less, to having malaligned teeth. And then some people actually have indigestion, constipation, and you don't think that it has anything to do with the arrangement of your teeth. It does. I have seen people like that because we tend to forget that the chewing of our food actually starts from the mouth. If you're able to grind that food into a pulp, like into something smooth, like a grinding machine, when it goes down into your tract, the digestive system is able to, digest it properly and your food can get the nutrients that it needs. But if your teeth are not touching, they are not functional, how do you even begin to digest that food? Something can be done. Let's talk about what you can do. The first place to start is to come in and see the dentist and have a consultation done. I don't want you to have a mindset that, oh, it's so expensive. No, ignorance is. Come in, have a discussion, a consultation with your dentist. Let them look at your occlusion. We will look at your occlusion and we will tell you what the problems are and what the solutions are. If the problem is that you have gaps in between your teeth, you have teeth that are overlapping, you have a gap in the center, maybe your teeth at the side are touching, but you have a gap in the center, your top and bottom teeth are not touching, we call it an anterior open bite. It could be as a result of habits. You're either sucking your tongue, maybe you sucked your finger as a child, you're a 1-star general, you're a 2-star general, it doesn't matter, come in. Maybe you suck your lip and it has made your teeth, proclined or protruding, as some people will say, out of your mouth. All of these things are things that you can solve using braces. Braces are orthodontic appliances, fixed orthodontic appliances or removable orthodontic appliances that we use to push or pull the teeth in the direction in which we want them to go to give you a straighter and more beautiful smile. You see, the straight and beautiful smile is like the icing on the cake. But at the end of the day, the most important thing, you get teeth that function better and teeth that will last you for a lifetime. I've also seen some people say in the comments, oh, braces are so expensive. No, they are not. Come in, have a discussion with your orthodontist and they will be able to give you a payment plan and guide you on this journey. Some people will say because it's expensive, they found it cheaper somewhere else. Please don't do that. If you have eye problem, will you come to me as a dentist to fix your eyes? No. So why would you now go to somebody who's not a specialist? If you have a heart problem, you see a cardiologist. If you have a gut problem, you see a gastroenteritis, because those people are specialists. If you have a brain problem, you see a neurologist, okay? Somebody who specializes in those areas. So if you have problems with your teeth that are not properly aligned, then you should see an orthodontist. An orthodontist is a dentist that specializes in the movement of teeth and jaws. They understand these things better. Don't say it's too expensive. There's a payment plan. See them, have braces done. Some people will say, oh, I don't want brackets and wires. There are different options for aligning your teeth. If you see the orthodontist, they will tell you what those options are. You can have options such as brackets and wires. They can be metal. If you have a job where you're constantly talking to people and you don't want the braces to be so obvious, there are other options. There are more aesthetically pleasing orthodontic appliances like ceramic braces. In terms of how they show, they are more in terms of aesthetics. They are closer to the tooth color than the metal ones. And if you want something that is more of an invincible way of aligning your teeth, then you can talk to your orthodontist about aligners. And of course, the aligners are also removable. If you're somebody that has a job, where you require those flexibilities. But if you speak with your orthodontist, the orthodontist will advise you on what will work best based on what is found in your mouth. Because like I will always say, orthodontic treatment, braces, it's actually a prescription. It's a prescription. And let me sound a note of warning to those of you that are doing fashion braces everywhere. Fashion braces can be very harmful. I have seen videos where people are placing brackets on the teeth. They don't even understand that these things are prescriptions. There are specific prescriptions for every bracket and specific brackets for every tooth. So if you meet somebody who's not a specialist, who doesn't know what they are doing, they can actually create more harm than good. I have seen patients that have gone somewhere else to see someone who's not a specialist and a tooth came out of the bone. I rest my case. I won't say more than that. See a specialist so that you can get the very best, okay? There are other options as well. If you do not require braces, then there might be other options like smile makeover. Will you be a candidate for veneers? And there are different types of veneers. It can be porcelain veneers, it can be composite veneers. But when you see the dentist, an assessment will be done and they will tell you what will work best for you. Please do not die in silence. Please do not feel hopeless. Something can be done. Take the first step. Book an appointment. See the dentist. Have that consultation today. And let us give you that smile that can help you improve the quality of your life. Grab those opportunities that come to you every day and live that life to the fullness. Remember, a smile is something that you wear. It's part of your dressing. If you are still watching this video, I'd like you to stop, subscribe, like, share, drop a comment in the comment section, and I'll be right there to answer it. I remain yours, Dr. Jonah Bonikena. The dentist is your friend. Thank you.